So a slightly funny place to start, but I was going to talk about, I feel like a military conductor with that. So, sorry, the laser doesn't work onto the thing, so I'll come to and from the video screen. So lab error is often kind of one of these kind of quoted things whereby if you get a result you don't expect, sorry, I won't ignore you, then you kind of put it down to lab error. Okay, fair enough. Most of the time it's us, actually, human error. We forget to do something, or we overlook something, or we weren't aware of something. So I'm starting here just to kind of highlight where things go wrong and start to introduce these kind of principles. So there's 3 ways you can break down so-called lab error, as I say, and often human error or human oversight. You can break it down into 3 things in terms of pre-analytical, or analytical, or post-analytical. So that's basically the stages of taking the sample through to the end test result that you get at the end of it, okay? And then what you do with it as well. So that whole kind of process. And we're going to deal with that to sort of concentrate on that today. The pre-analytical and the post is kind of more today. The analytical is obviously, when you stick your blood sample through your hematology analyzer, then it's kind of black box. You don't really know what's going on. I'll introduce how they work to a degree, but they are inherently have their own limitations. Each one is slightly different to the other, so I can't really kind of cover every single type today, but I will show you the kind of principles that go into what they assume and how they work. So it's just bearing in mind though that they do have limitations, and I've just put the portable blood glucometer there versus a biochemistry one. So you may well have both in your practice, one for diabetics kind of idea, and one for the kind of routine profiles and screens and those sort of things. They measure glucose in quite a different way. They actually measure it on a different thing. So bear in mind that a glucometer measures it on whole blood, and the biochemistry analyzer measures it on plasma or serum, depending on the two, and they are different. And so therefore, this is making an assumption on how much blood is there, as in how many cells are there. So if your animal's anemic, then the assumption is it's made are wrong. Okay? If the animal is dehydrated and the red cells are more as well, the assumptions upon which it then measures and assumes that and calculates that glucose are wrong. Whereas the other one, in terms of the plasma and the serum, aren't wrong because they're less affected by that cellularity. Okay? So again, it's kind of being aware that there are assumptions that the analyzer makes and the testing process makes when you're getting this result. It's not just a black and white, and often, and too often it's wrong in terms of being overused and therefore misdiagnosed. Okay?